there, it's Brad Beer, POGO's founder and also senior physio. Today I'd like to talk to you about the causes of knee pain. There are several key contributing factors or causes that develop knee pain for people. Knee pain's a massive problem. It's not only a problem that affects the young, it also affects the elderly, it affects the middle age and every age category or decade of life in between. Knee pain conditions can include osteoarthritis of the knee, osteoarthritis of the kneecap. It can include acute sporting trauma, injuries such as ACL ruptures, medial ligament tears, lateral ligament tears. Knee pain can also include conditions of growth in childhood or adolescence. This can include conditions such as Osgood-Schlatter's, Sinden-Larsen syndrome, and also your tendon problems such as jumper's knee, otherwise known as patellar tendinopathy or tendinoses. So, knee conditions are wide and varying. Interestingly, the causes of any of these conditions have several key factors that, irrespective of the pathology, will be contributing to the development and the ongoing nature of any pain that any one of those knee conditions can produce. In practice, I regularly will draw a diagram such as this for my patients. The reason for such a diagram is that it examples that there's never just one sole single cause for knee pain, or in that matter, any condition, any injury. There's always more than one contributing factor. A good physiotherapist and a good physiotherapy process will be able to help you learn what are your key or predominant contributing factors for your knee pain. Now, whatever the condition, remember, there's common causes. Here is a few of them. Genetics. I'll start with this because it's a big misconception amongst a lot of people. Many people will say, I've got bad knees. My father had them, my mother had them. That is a misnomer. Typically, you don't inherit knee injuries or knee pain from your mum or dad. The only component of genetics when it comes to knee pain can be the type of cartilage, or to be more specific, collagen that you inherit. That has to do with the degree of mobility that you will have in your joints. However, it's a small component based on the mobility of your joints and more specifically based on the type of cartilage or collagen that you have lining your kneecap, knee joint, and also putting everything together in your knee. So that's genetics. The major reason though that people will experience ongoing knee pain is because of this: tight muscles. Now, whatever crosses the knee joint will make the knee tight. Muscles such as quadriceps, hamstrings, calves, all cross the knee joint. So, when these muscles get tight, they act like a compressor on the knee. This increases the loading on the knee joint, and load in excess will create and perpetuate pain. One of the other key contributing factors and causes of knee pain is weak muscles. So we've had tight muscles, those muscles that cross and span the knee joint. We've also got weak muscles. Weak muscles will typically refer to the muscles sitting above the knee. These muscles include muscles of the hip, the glute max, the glute medius, and the deep hip external rotators. The net effect of when these muscles aren't working correctly is that the pelvis will drop and often internally rotate, or what we term a Trendelenburg sign will be evident, whereby the hip collapses and that puts more load on the knee joint. Remember, adverse or excessive load will create pain and perpetuate the pain that a patient may be feeling with their knee. Body weight is another key cause of knee pain. It's not one that people are often comfortable with. However, the stark reality of body weight is that every frame has an ideal weight, and if you are 1, 2, 3, 4 or 5 kilograms over your ideal body weight or frame weight, as I like to say in practice, then you are doing your knee a disservice. Now, if you were to compound that and be overweight 10 kilograms, 15 kilograms, sometimes even 20 or 30 kilograms, your body weight will be contributing enormously to your knee pain. In fact, many orthopedic surgeons, for people with advanced wear and tear of their knee who are down the track looking at needing a knee replacement, will actually be advised to go and lose weight, receive some physiotherapy, exercise within pain, and come back and see the orthopedic surgeon often in 5 or 10 years. That's how important body weight is. One of the other key factors or causes of knee pain is your foot type and position. Quite simply, there's 3 types of feet, I should say. One is the overpronating foot, 2 is the supinated or high arch foot, and 3 is what we call the normal foot. Now, the foot type that tends to challenge or produce the most problems for knee pain, or in terms of knee pain generation, is the overpronated or excessively dropped arch foot. This foot creates a rotation or a torque around the shin, which increases the loads that go on the back of the kneecap and through the knee at large. So just to summarise, there's several key contributing factors and causes of knee pain. Genetics, tight muscles, weak muscles, foot type and position, and your body weight. Now, the other key consideration is the activities that you do. If you are doing repetitive activities such as walking, running, or playing a sport that you love, then these are great things. However, if you're doing those with tight muscles, weak muscles, a foot type that's not ideal, genetics, or you're overweight, then you're putting your knee at risk. So, in summary, there's multiple causes of knee pain. A good therapist will be able to help you identify what are your key contributing factors and help you therefore get recovered in the quickest and most effective manner possible. I hope that helps. All the very best. And don't forget, if you don't have time for good health, you won't have the health for a good time.